Hi friends, in this video let's talk about the 10 early signs of cancer. Keep in mind that just because you have one of these signs does not mean you have cancer. This list is meaningless unless you learn the fine details by listening to my explanations that you simply won't find anywhere else. Lots of these things are super common, and that's the thing with cancer, it hides under plain sight. Now this video is not fear-mongering. Early detection saves lives and families. A few years ago my friend was telling me how she had this lump in her breast and she was finally going to see a doctor the following week. She could no longer participate in our homeschool co-op because she had cancer that spread to her lymph nodes and she needed time off for chemotherapy and surgery. The joy, hope and laughter in her voice prior suddenly changed to apprehension, worry and sadness for her son, who wasn't even 10 years old now, even though she was only told of her diagnosis 1 day prior. She actually knew for months that she had a growth, but she ignored it. Again, these signs are not specific and nobody can look at anyone and say for sure they have cancer. In fact, cancer is a metabolic problem. It is not uncommon that chronic infectious diseases can mimic the same signs and symptoms as cancer, and hence I have a day job, and unlike certain cancers, many chronic infections are very treatable and curable. Now oftentimes the body will just simply take care of problems on its own with the right support. Now keep in mind that the most deadly cancers, they actually are the ones that have no signs and symptoms until it's way too late, like pancreatic cancer. So if you are concerned at all, go see your medical doctor. That's what we are trained to do better than any other profession. Now the first sign is a painless lump, but sometimes can be a cancerous growth, benign tumor, or an actual infection. Now there is a difference between a benign tumor and a cancer, and sometimes the words tumor and cancer they're actually used interchangeably because we don't really know that a tumor is benign until it's biopsied. A tumor is simply an abnormal growth or a mass, and a benign tumor, that mass or growth, it stays separate and is localized, but a tumor that becomes cancer crosses tissue planes and it can spread to distant parts of your body. Now you would think that if you have a mass the size of an orange growing somewhere in your body, that is hard to ignore, right? But unfortunately somehow lots of people still ignore lots of big masses. Why? Cancer takes years to form, and lumps even the size of an orange, especially if it doesn't cause any pain. Now abnormal tumors or growths or lumps or bumps, they can occur in any part of your body, from your legs to your abdomen to your chest, and even your head. Please don't ignore them. If it's an easily accessible growth, a simple biopsy can tell us what it is. Now sometimes it's a collection of fat that your doctor can easily feel and tell that it's benign, and sometimes it can be a treatable infection like coccidioidomycosis, and sometimes can be cancerous. Now infections versus cancers I had mentioned are hard to tell apart until we can get a tissue sample, so obviously there is a big difference because treatment for an infectious disease is very different than treatment for cancer. And by the way, both can destroy tissue, can spread to other parts of your body, can not only reduce your quality of life but it can also shorten your life, and hence it's always better to front-load the effort, get an early diagnosis and have a treatment plan. And that's why it's always good to get a perspective of an experienced professional like a real medical doctor. Now the second sign are lumps in odd places deep in your tissue or around your clavicle, your armpit and your groin. These are lymph nodes, and they're usually telling you that your immune system is on hyperdrive. Now when was the last time that you actually felt around your clavicle and your armpit, or even around your groin? I personally think it's a good idea to feel your body parts to know what's normal and what's abnormal. Energy failure inside cells, and to make sure that there is no abnormal growth. And one day you may feel something different, and that may be totally okay because lymph nodes will come and go throughout your lifetime, and that's because whenever your adaptive immune system gets turned on by, let's say, a germ, common cold, your lymph nodes will increase in size. These nodes are like the homes for your B cells, and your B cells, they generate antibodies to make these sticky bullets against germs. So whenever I feel a lymph node, that means your immune system is activated and working hard to keep you healthy. It is triggered by some kind of stressor in your body, and oftentimes it could be just a common cold or some kind of skin irritation, but occasionally they may be a sign of cancer. Now lymph nodes that are less than 1 centimeter, they're usually not significant, and much of what we feel around a lymph node is fatty tissue, so the actual lymph node is much smaller. There are exceptions to the rule. So lymph nodes in your supraclavicular fossa, that means right like next to or underneath your clavicle, is actually significant if it's over a centimeter. But if we feel nodes in the armpit or groin, it's really not uncommon for us to watch it if it's less than 2 centimeters. Now oftentimes what we feel are not just a single node but a collection of nodes together that makes it feel bigger. And soft nodes are unlikely to be a problem, but if they are rubbery, blood sugar and tumor growth, that's a classic sign for lymphoma, and if they're hard, that's actually a classic sign for some kind of malignancy or even certain infections. And whenever I feel a lymph tissue, I'm always looking for symmetry, so that means if I'm feeling in one part of your body, like your right side of your body, I'm looking at the counterpart on the left side to see what is normal for you. Lymph nodes drain the lymph fluid from specific parts of your body, so a left supraclavicular lymph node or a Virchow's node, that's a classic sign that there is an abdominal problem going on, but a right supraclavicular lymph node that drains the chest cavity, and that tells me that there is a process going on in your chest. Now the third sign is a chronic non-healing wound. Chronic wounds have a higher chance of turning cancerous simply because there's lots of tissue turnover, but most of the time when I'm looking at a chronic Non-healing wound. It's due to a combination of poor nutrition and poor wound environment for healing, lots of times just offloading the pressure, treating any kind of infection that could be there, and supplementing with things like zinc, vitamin C and micronutrients along with eating the right foods is the solution most of the time for good skin. And that leads me to taking my supplement. Hold on a sec, I keep forgetting that's why I have it here today. Rebuilding skin tissue. It really takes a lot of energy, insulin and growth signaling, and hence just eating calories is often not good enough, especially when 20% of the foods sold in the supermarket they are missing essential nutrients necessary to rebuild tissue. But ultimately, even after everything is done, including taking the right supplements, and if the wound doesn't heal, then we may have to do a biopsy to make sure that it's not cancerous. Now the fourth sign is persistent redness on a patch of skin that just never goes away. Now notice how I keep talking about the skin. Your skin is your largest immune organ, and whenever something is going on in the body, usually it will show in the skin. Now people don't recognize it as that, but that's what first shows. It's like the sentinel chicken of your body. It will notify you ASAP, and too many people, we just want to cover up skin problems and really not explore and go into a deep dive of what's really going on the root. Cause so persistent redness on the skin is usually something very common like irritation, like eczema, sun damage, and all of these factors actually increase cell turnover, which potentially increases turnover mistakes. However, they usually wax and wane, but a persistent red patch that won't leave, that can be cancerous, especially if it doesn't improve with basic care. And one of the most common cancers that can present with redness is basal cell carcinoma, which people picture as a shiny bump, but it can also look like a flat pink red patch that slowly enlarges, sometimes with a slightly raised or rolled edge. Mitochondrial damage, tiny surface blood vessels, and a tendency to scab and then heal and then scab again, and it comes in the exact same spot, especially on sun-exposed skin like your nose, your cheeks, your forehead, your scalp, your ears, your neck, and your shoulders. Another cancer is called squamous cell carcinoma, which can begin as a rough scaly red patch or a red thickened area that feels like it's sandpaper. It may be sore, itchy, and it can develop a crust, and it is more likely than basal cell to become a firm bump or an open sore, and that just persistently doesn't heal. And then there's an early form called squamous cell carcinoma in situ, often called Bowen's disease, which can look like a persistent, well-defined red scaly patch that people often mistaken for eczema or psoriasis because it just looks like a rash, but it doesn't behave like a rash, and it stays in one spot and it slowly grows. So if you notice a red area that is persistent, document that properly. Take a photo every day in the same light. You can place a ruler or a point next to it for scale and write that down, or mark it in your pictures, and then you bring that to your medical doctor, right? Document any symptoms like itching or pain or bleeding or crusting, and if you are experimenting with anything at home like acids or steroids or random products, chronic inflammation, mark that down. Record that. Hi friends, I am so thrilled that you want to take charge of your health and take charge of your food. Now I know nutrition can be complex, but it doesn't have to be, and I'm here to support you in this lifelong journey. So if you point your camera app to this QR code, it'll take you to a link for a free handout that I created just for you. And if you like it, if you want to see other handouts, please go to the link in my show notes, and then you can leave me your feedback on what I could do to help you in your journey. Okay, back to the video now. A fifth sign is night sweats, and most of the time your room just may be a little warm, or maybe you have a little anxiety or stress, or you're going through the change and having hormones, or even a bad dream, but persistent night sweats, especially when you're drenching and it's unexplained, our classic warning sign we doctors are trained to take quite seriously, because certain cancers can trigger night sweats long before we notice any pain or lumps or bumps. The key idea is that cancer disrupts the body's internal thermostat. Cancers often cause the release of inflammatory chemicals called cytokines. Those cytokines affect the hypothalamus, the part of the brain that regulates temperature, which causes a sudden drop in set point during sleep, which can lead to intense sweating, as the body is trying to cool itself down. And this is very different from sweating due to, let's say, heat or exercise immune system breakdown, because often what happens is that you're in a cool room and yet you're soaked through your clothing and your sheets, and that can actually wake your buddy up from the other side of the bed. Now, one of the cancers most strongly associated with night sweats is lymphoma, both Hodgkin's and non-Hodgkin's lymphoma, where night sweats are part of what doctors call the B symptoms. Those symptoms are, along with other unexplained symptoms like weight loss and fevers, they can also be seen in leukemia, other solid tumors like lung or kidney cancer. So it's really non-specific. Lots of cancers can trigger lots of inflammation, activate the immune system in the wrong way, and in this case sweating, it's not random, it's actually a systemic signal that something is happening. Some kind of inflammatory triggers inside the body, and what makes night sweats concerning, and it's not just that you're sweating in the middle of the night, but it's a pattern. They become recurrent, they're not occasional, and they are severe enough to require changing your clothes or your bedding. Sometimes they will persist for weeks unless you get proper treatment. Oftentimes they occur without any obvious explanation, so like I said, if you're in menopause, if you're dealing with an infection, you have a cold, sometimes even alcohol, medications, or being in a super hot environment, environmental toxins can cause night sweats. And I mentioned there's usually other clues: fatigue and unexplained weight loss, or the inability to gain weight, that accompanies night sweats. So even though I'm going through 10 symptoms, you really shouldn't take any one of these alone to be yay or nay. It's really a combination that raises concern, and that's why you need to get the advice of your own medical doctor. Don't ignore your night sweats, don't just assume it's anxiety, document them, talk to someone. It's always good to get another perspective in life. And the good news is there's lots of other things that can cause night sweats, right? So don't sweat it. If you're having night sweats, the sixth sign is unexplained fevers. Now, fever, like night sweats, fever and cancer, is driven by cytokine signaling, immune activation, tissue breakdown, and altered metabolism. Usually we associate fevers with having a bacteria or other germs, but many people who have cancer actually don't have an infection, or they can have an infection. Even a dormant infection can blossom, or they can get a new infection. But when your fever is persistent, it's unexplained or recurrent, especially if you have other symptoms like night sweats or weight loss. Appetite changes that deserves careful evaluation by a medical doctor. It's important not to just take a random antibiotic to get rid of your fever. Now, the seventh sign is a change in taste, and that's also through a change in inflammation and nerve signaling disruption. Processed foods and cell stress that affects your taste buds. Suddenly things may taste metallic, bitter, overly sweet, or completely bland. So these cytokines are released by the tumors that can circulate through the body, and they can reach your tongue and your brain and alters how your taste signals are generated and interpreted. Now, taste buds are one of the fastest turnover cells in the body, and so chronic inflammation will slow their renewal. This leads to fewer functioning taste receptors and a distorted flavor perception. And another mechanism involves your nerve and your brain signaling. This is not just on the tongue, it really depends on your cranial nerves as well as the brain regions that integrate the taste and smell. Cancer-related inflammation, they can always impair these pathways, so even when taste buds are intact, the brain can misread the signal, and this is why people with cancer, they report that the food just doesn't taste like it used to. Cancer also disrupts saliva composition and mineral balance, especially zinc, and zinc is essential for your taste bud structure and function, and cancer-related inflammation can lower the circulating zinc or impair its utilization. Now, we reduce saliva flow or alter saliva enzymes that can also further dull taste buds and amplify the bitterness, particularly with protein-rich foods like meat, and this explains why it's commonly to have a meat aversion when you have cancer, which is honestly a good thing because meats can increase your risk of cancer's nutrient deficiencies. Changes in smell and perception compound the problem because much of what we taste actually is how we smell your food. So inflammatory changes in your olfactory system, it also blunts the aroma detection. It really flattens the flavor complexity, and when the smell drops, sweet and salty notes may dominate while subtle flavors, they can disappear, and this makes the food really unappealing or taste off. And finally, the brain's reward response to flavor can be altered. The dopamine signal by to eating pleasurable foods, and that anticipation of eating that's reduced by inflammatory signals. So even your favorite familiar foods, they can lose their appeal, and eating becomes a chore, effortful rather than enjoyable, reinforcing therefore you get an appetite loss and early satiety. The eighth sign is loss of appetite. Of course, if you lose your taste, you lose your appetite oftentimes. Right, they go together. Cancer, though, can suppress your appetite through several overlapping biological pathways through the gut and brain, access through your hormones and your immune system. And the appetite loss in cancer, it often feels profound and out of proportion to food intake. And this is why willpower isn't an issue. It's really a systemic metabolic shift driven by the disease itself. One major driver is chronic inflammation. Foods that support cell health, again, your cancers release cytokines, all different types of cytokines, and those cytokines, they travel to the brain and then they interfere with the brain's signaling, especially in the hypothalamus region, and that region is the center for hunger and satiety. So there's a mismatch. The brain interprets the body as being in a constant illness state, so it reduces the hunger signaling and increases early fullness, but the body, though, is desperate for calories and proteins, and unfortunately it interferes with the normal hormonal signaling that is responsible for appetite. Levels of ghrelin, leptin, they're all distorted, and at the same time you may become more insulin resistant, and glucose is also less effectively used by healthy tissues. The brain, it signals inflammatory chaos and responds by dampening the appetite rather than stimulating it, and if you have a cancer, they're consuming a large amount of your food, the glucose amino acids, effectively hijacking nutrients before the rest of the body can use them. So your good organs like your muscles are starving for cellular energy, and then the body shifts into a catabolic state. Prevention through daily habits called cancer cachexia, and in this state the muscle and fat, they're being broken down regardless of how much people eat, because eating more doesn't reliably store appetite or weight, and cancer will directly affect the digestive system, especially if they are near the gastrointestinal tract. They can slow gastric emptying. This increases nausea, alter taste and smell, and can cause early satiety after just a few bites. And even cancers outside the gut can disrupt the vagus nerve signaling, which is the largest peripheral nerve outside of your brain. So normally it tells the brain that it's safe and appropriate to eat. And remember, you have a blunted reward food response, right? People don't enjoy food like they used to because the inflammatory signals, it really damages that dopamine response. And so at that point, then eating feels forced, and unpleasant, and a lot of times why people say they're not hungry rather than they're full. And you can imagine that night sign is weight loss, the combination of everything that I just explained, a loss of appetite and a loss of taste. But Cancer also causes weight loss by driving inflammation, hijacking nutrients, and accelerating tissue breakdown, so the body's metabolic balance gets fundamentally disrupted. So the last sign of Cancer is persistent fatigue, and fatigue in Cancer outro is one of the most common and earliest symptoms, and it is fundamentally different from ordinary tiredness because fatigue, it doesn't improve with rest, and oftentimes it's a deep whole body exhaustion. And this can happen because Cancer disrupts energy production as well as immune signaling and tissue repair all at the same time, and it pushes the body into a chronic low energy state. Excuse me, I need to get some energy. Obviously fatigue is so non-specific, and there's so many other reasons, so if you want to learn more about that, watch next video.